A debate is raging among some of the top infectious disease experts in the country, including former advisors to President Biden, and the stakes couldn't be higher. Biden's pandemic response strategy, released on his second day in office, said the federal government would explore strategies to conserve vaccine doses. One popular idea is to administer as many first doses of the highly effective Pfizer and Moderna vaccines as possible, and delay second doses by 3 months instead of 3 weeks or 4 weeks.
If we don't postpone the second dose, all we're going to be giving over the next few weeks is second doses, and that is bad.
But in the 3 months since the White House released the plan, top health officials haven't budged.
Although we always continue to keep an open mind, we consider the route that we're on now as the best route.
The UK, meanwhile, has delayed doses by 3 months. Canada has delayed them by 4 months. A single dose strategy could either tamp down a variant-driven surge or encourage one, depending on who you ask. Some argue there is a moral obligation to administer as many first doses as possible, and that the evidence points to durable immunity with 1 dose. They point out the pharmaceutical companies picked 3 and 4 week intervals so that they could finish the clinical trials quickly, not because it optimized a person's immunity or public health. The idea of stretching the interval between doses has apparently stalled since a March 1 CDC meeting. A working group said that there is insufficient data to suggest changes to guidance. The working group acknowledged that the second booster shot was likely to be effective after a longer interval, but the group was concerned that 1 dose could leave people susceptible to variants and contradict the FDA's emergency use authorization. The working group also considered only giving first doses to people who have already been infected, given that people who have been previously exposed to the virus seem to develop a stronger immune response. Still, the working group decided against the strategy because the data is limited and testing people for antibodies before vaccination would be difficult. Plus, it would contradict FDA recommendations. So far, White House medical advisor Tony Fauci is sticking with the original plan.